sativa is a plant. It's a flowering herb, and we've been using it for about 8,000 to 10,000 years now, dating back to ancient China, ancient Egypt. It was used for glaucoma, for menstrual cramps, for pain. It was used by Queen Victoria famously for her menstrual cramps. It was also used in colonial America, so George Washington grew hemp at Mount Vernon, so we have a long history of it in the US too. It was legal up until 1938, so until then we were selling it in pharmacies. It was used as an antispasmodic and used for pain. And I won't go into the politics of it being banned and all that, so since we're in a legal state, I won't really talk about that too much. But the cannabis plant can be broken down into different components, and so there are over 100 cannabinoids within the plants, and there are also terpenes in the plant. So cannabinoids, the most commonly known ones are CBD and THC. So CBD is what I'm going to focus on today. That's the cannabidiol, and THC is tetrahydrocannabinol. And I just wrote a few more up here. Again, there's over 100, so we're still discovering new cannabinoids. So CBD is the component that doesn't get you high, and THC is the component that does get you high. THC also does have medical benefits, so it's not, getting you high is not the only job of THC, but CBD is known more for its medicinal benefits because it doesn't get you high like THC. It does tend to make most people feel slightly alert and calm, so I wouldn't say that's absolutely no psychoactive effects, but it's not going to impair you in the way that THC can. And the terpenes are found in various plants, so not just cannabis, but pinene is an example of a terpene, and that's found in pine needles. It smells like pine needles. It's also found in some cannabis plants. Limonene is another one. That one smells like citrus, and that one tends to have tends to be a mood elevator. So the terpenes are really important for giving the cannabis its smell and also for giving it its medicinal effects. And then I just really wanted to focus on whole plant synergy. So we have these various cannabinoids and these terpenes, and they're all working together. And we don't really know exactly how they're all working together. We're still learning a lot about it. So if you use the whole plant, there's something that they call the entourage effect, where the sum of the parts is greater than you'd expect it to be. So 1 + 1 = 5 instead of 2, because all these parts are working in synergy. So ideally, if you use the whole plant, you can have more of a benefit than if you just isolate one part of it. So even though I'm going to focus on CBD, I'm also going to stress the importance of using whole plant-based products instead of just isolates. And then just to further classify the cannabis sativa plant, it's considered hemp if there's less than 0.3% THC. So that's what the definition is for hemp. And then it can further be subdivided into sativa, indica, and ruderalis. So sativa and indica are the most commonly known. If you go into a dispensary, that's how things are going to be classified most likely. Sativa, indica, or hybrid. And the sativa has more of the uplifting kind of high. It's not going to make you feel that couch lock effect that the indica can have. Indicas tend to be more sedating and more for pain. But these are really kind of generalizations, and hopefully we'll get away from that and focus more on the terpenes as the industry kind of evolves, because we're really finding out how important terpenes are, and especially for the medicinal effect. So once you know how certain terpenes affect you, it's easier to choose which strains will work for you. And so there was one study that was done in mice. It looked at pain and inflammation, and they looked at single compound CBD versus the whole plant CBD. And they also compared that to aspirin, and both of the CBD compounds were much more potent than the aspirin for anti-inflammatory effect. But what they found was that for the single compound, it had a little bit of a narrower therapeutic window. So it worked, but after the dose went up, people lost, or not people, sorry, mice in this case, the markers that they were looking at, the inflammation, it stopped being effective. And when they used the whole plant, they found that that didn't happen. It did kind of plateau out. They didn't need to give any more, but the effect didn't go down. And they also found that they could give a much lower dose and see a response quicker. So again, going back to this whole plant synergy, you can use a smaller amount, but you have all of the components working together and you're gonna have more of an effect.